It is now 4:31. I would like to call the meeting to order. Can we do the roll call, please?
Andy Cornstrom, Darlene Kleppel,
Here,
Danielle Chenoweth.
Present.
there is a quorum present and the meeting is called to order. Next, we have approval of the agenda. Can I get a motion?
So moved.
I'll second. Would the clerk call the roll, please?
Andy Cornstrom, Darlene Kleppel,
Yes?
Danielle Chenoweth.
Yes.
Okay, next we have approval of minutes of the previous meeting on April the 12th, 2021. Can I get a motion to approve those minutes?
So moved.
I'll second. Call the roll, please.
Andy Cornstrom, Darlene Kleppel,
Yes?
Danielle Chenoweth.
Yes.
Okay, and next is public participation. Do we have any members of the public tonight that wish to speak to the board? If so, you can raise your hand or just speak up. Okay, seeing no members of the public, we will move on to correspondence. Any correspondence for the board?
Well, the FDA just minutes ago approved the emergency use authorization for youth 12 and up for the Pfizer vaccine. We know that ACIP is meeting on on Wednesday, and from, I don't know, 11 till 5 or something like that. So we anticipate that starting Wednesday evening, we will be able to vaccinate people 12 and over with Pfizer.
Great. Okay, good news. Let's see, now we move on to old business. Any old business? Doesn't look like there's any old business to conduct, so we will move on to new business. And we need the treasurer's report.
Yeah. As of the end of March 2021, we had the balance sheet with a cash balance of $4,052,760. Our total fund balance was at $5,812,924. That represents 31% of the budgeted expenditures, and that exceeds our 25% self-imposed guideline. Ending the 9th month of the fiscal year with a surplus of $1,134,470. And that's against our annual budget of just over $18.6 million. On the income statement side, we had total revenues of $12,249,769, which is almost $1.8 million under our year-to-date budget. Part of those areas was our property taxes was actually under budget year-to-date by $48,683. And that's because in the 9th month of the fiscal year is when we take the bad debt that we're anticipating we might be getting and we write that off. And so that's why that went into a deficit. Grants and contracts made the biggest shortfall in the year-to-date budget of just about $1.5 million under the year-to-date budget. And we had about 600,000 of that still sitting in accounts receivable. So we're hoping to get that in. Fees for services were also under the year-to-date budget of $230,000. The expenditures for the year was at $11,115,299, which is about $2.7 million under our year-to-date budget, mainly due to personnel at $1.6 million, benefits which go hand in hand of almost $800,000. So.
Okay, thanks, Ron. Any questions for the treasurer? All right. I think we need to move on. Do we need to accept that and place it on file? The treasurer's report? Do we accept it and place it on file?
Yeah.
Okay, I'm accepting it and placing it on file. Next, we have approval of payments to the Board of Health appointees, to the treasurer, Ron Fields, in the amount of $404.98. Check request 1437, and for attorney Ruth Wyman in the amount of $1,050.20, check number 1418. Can I get a motion for those payments?
So moved.
Thank you, Danielle. I will second. Will the clerk call the roll?
Andy Cornstrom, Darlene Kleppel,
Yes?
Danielle Chenoweth.
Yes.
Okay, next is review of the monthly credit card statements. Who's going to do that?
I think it's in our packet for review. And if we have questions.
Does anybody have questions or comments about it? I guess we need a motion first. Do you want to accept the
I would-
credit card statements?
Yes, I would move to accept the credit card statements.
Okay, and I'll second that. Do we have any questions about the credit card statements?
No.
Okay, can we call the roll to place those on file or accept them?
Andy Cornstrom, Darlene Kleppel,
Yes?
Danielle Chenoweth.
Yes.
Okay, the next is a presentation by Darius Carter on behalf of the Equity Council. Welcome, Darius. Thanks for being here tonight.
Thank you all for having me. All right. So I was going to share my screen. It says right now that I cannot do so, but I can just go ahead and present if that's not a feature that I can go ahead and do right now.
Can you change that, Amy?
Oh,
Give him the,
make him host on it.
yeah.
There we go. Host.
Oh. Perfect. Can everybody see that?
Uh-huh.
Perfect. All right, so we are the Equity Council. We're also going by the Coalition for Liberation. I thought this would be a great time just to introduce everybody to who is on the council. So as previously mentioned, my name is Darius Carter. My pronouns are he, him, his. I am a prevention specialist here at Public Health, as well as one of the lead COVID-19 investigators. And those who are on the call, if you want to introduce yourself, you absolutely can. If you don't, I completely respect it.
I can. Hi, my name is Michelle Keisio. I'm a family educator here at Public Health, and I'm also an Equity Council member.
I forgot to unmute myself there. Hi, everyone. My name is Beth, and I go by the pronoun she, her, hers. I'm a family educator here, and I'm also a member at the CUPHD Equity Council.
Last but not least, hi everybody. My name is Rami Wilson. I'm the lonely wolf in environmental health. And that's pretty much all I am outside of the Equity Council as well. So nice to meet everyone.
So thank you all. All right, so I just want to talk a little bit about why we are here and what we hope to accomplish. I know there probably have been a lot of whispers about what the Equity Council is, but we hope to educate public health staff on social justice topics, so social justice, leadership, and education. We want to mobilize tangible change, so we really want to focus on policy. And today, this is a policy that we're hoping that we will get approved. And then we also want to address various forms of oppression from a public health and social justice lens. I think when we talk a lot about public health, we have to talk about social justice simply because that's the stance in which we all come from. So today we'll be talking about our livable wage initiative. Looks like someone just joined the call. We want to talk about what the difference is between liberation and equity. So we want to move towards a framework that ensures fairness. I love this graphic right here. Many of you have probably seen it, where it highlights the difference between equality, equity, and liberation. As you can see in the first graphic, everybody's given a table or a stand to see above the fence, but not everybody necessarily needs anything to be propped up to see beyond the fence, right? Whereas equity, we give the appropriate amount of stands or boxes so folks can see beyond the fence. And I always say that the fence is a form of systemic oppression, right? It's that barrier that we're struggling to get past, right? But the ideal type of situation is to, liberate ourselves from the fence entirely, from racism, from homophobia, et cetera, et cetera. So I really want for everybody to think about liberation as we move forward throughout this presentation. So livable wage is the national conversation right now. I think that, it's on everybody's mind. I know it's on every news article. So we really want to talk really quickly about how that will play into CUPHD's budget. So this is a livable wage calculator from MIT. It just gives like a rough estimate depending on how many folks are in the household. So if you look at the bottom, you see, if there's one adult or there are two adults working in the home, and based on how many children live in the home, what that livable wage technically needs to be. Now, granted, we understand that it can't be adjusted as such, but this is why it's imperative that folks have a minimum of $15 an hour while they're at work. And I can talk more about that. I just don't want to take up everybody's time. So if we look at our budget, our salary budget without fringe currently is $6 million. When I did the overview, I found that about 11 staff were not making $15 an hour. And this is according to last year's 2020 salary after the cost of living adjustment. Pat and I both ran our numbers and both were pretty similar. It's roughly around $38,800, which is the amount difference that it will play into our $6 million budget. We also did a SWOT analysis for this. So we wanted to look at the strengths, weaknesses, opportunities, and threats. If we look at the strengths of this, we have the current infrastructure to make said change. So that part should not be the issue. Where we look at weaknesses, it most likely will be short-term satisfaction, where it plays into, staff's not willingness to work, but just overall satisfaction with work, right? We know that, a lot of people may be excited for the $15 an hour, but that obviously can change over time. Opportunities, staff can now pay their bills. At the very end of this presentation, I have resources and articles just indicating how $15 does impact someone's healthcare and their ability to really just fuel their finances. And then lastly, some threats. When we look at the salary projection over the next few years, as well as like the cost of living adjustment, obviously that $15 will begin to increase. So that is the main threat to this SWOT analysis. But the big concept here is income inequality is a social justice issue. When we talk about income inequality, it's a race issue, it's a gender issue, it's an issue that plays into folks' ability status. So we really need to make sure that, as we are the epicenter for change, especially in the midst of COVID, that we're also the epicenter of change when it comes to being a model for other public health departments and districts to make sure that their folks have a livable wage. As indicated, I have a few resources here if you all want to read that. I did not want to bore everybody with stats, but I would definitely suggest reading those articles as it provides great context to what I was talking about, okay? And that is pretty much it. I have my email there, obviously, if the board has any questions or concerns later on, but that is all that I have for everybody. Now, how do I stop sharing? There we go.
Thank you, Darius.
Thank you.
Okay, thanks. Can we ask a couple questions, or would he know the answers to questions about this, Julie?
Yeah, go ahead.
Okay, so
They're on
one
here.
question that I have is, you're looking at trying to move everyone's minimum wage up to $15 an hour. And I know the federal government did some work on this, and there are certain requirements that people have to meet at this point according to the federal law, which I think would bring everybody's minimum wage up to $15 an hour by 2024, I believe it is. So what was the impetus in just moving that forward?
Well, it was, well, first of all, it's the right thing to do, but second of all, it is, we only have 11 staff. We pay, what is it called, Pat? What is it called? We pay a living wage, is it called?
Yep.
And so this was, there weren't that many people that were under that, but it was, we want to be, ready for it. And It is something that was brought up, and the leadership team, we talked about it a lot, and we told them to move forward with it. Yeah,
Okay.
we're not necessarily going to wait for the federal government to do something.
Okay.
We typically don't. So.
And the other question I have is those 11 people, is it a certain job that you have that all 11 people are getting paid at that wage? Or is it like a mixture of some people are getting paid 11 and some people are getting paid 15 and some people are within job descriptions that should be the same?
Yeah, Pat, do you remember?
Sure. I don't have anything in front of me, but mainly it's maintenance technicians, is specific job specifications that are in our range 1 and 2 that are under the $15 an hour that we
So
want to raise.
You're proposing that you would raise the entire range for everyone in that category? Or you have some people in that category making minimum and some people not?
We have a few people in the categories in range 1 and 2 that are making above that, and some that are not, depending on their length of service. So that is what we're proposing, of those total 11, moving them up to the minimum of 15.
Okay, so what would happen to the people that are already making more than 15?
Nothing.
Okay.
Are some of these the mosquito bikers?
Yes,
Yeah.
mosquito bikers that are summer positions. We just hired about 85 contact tracers, and we hired them in over $15 an hour. So that's when we started looking at that, thinking we have people who are here on a temporary basis that we're paying more than employees that have been here 4 or 5 years, and we don't feel that that's equitable. So that's the reason why we want to look at that, not wait for the feds to do anything about it.
Okay, Danielle, did you have a question?
No, I just wanted to make a motion to approve the proposal to raise all employees to minimum wage of $15 per hour.
Okay, the next agenda item. Okay.
So I just put the motion on the
So there's no more questions. Okay. I guess that's fine. I got my couple answered.
Okay.
So I will second that.
And just, I'll try not to suffer you through my voice, but I just want to say thank you to that Equity Council. I don't believe in paying less than $15 an hour in my office. I don't really believe in waiting on the federal government for that issue, or the state for that matter, that continues to push off those increases. I really appreciate you all working with staff to quantify the budget impact and the number of employees. And I was, Ruth, when Ruth Wyman and I were on city council, we actually set a living wage for Urbana. And there were those of us who worked at the county level to pass the living wage ordinance. So, this is absolutely a racial and gender equity issue, and I appreciate that you all brought it to us. Thank you.
Yeah, and I would like to echo that. I also am trying to get all the county salaries up to more than 15, and I think we're at that point now. But I would also like to say I think there's a little bit of an issue that you might want to consider with the people that are currently over 15. Just because if you're bumping everybody, I don't know how much you're bumping everyone, maybe $1 an hour or whatever. There tends to be a little bit of pushback from people. I think they like the fact that you're giving raises, but they're feeling like they sort of got left out if they're already over that amount. So if they're in the same job description, you might want to just take a look at that and see if there's anything you could do there or what you would do to kind of make that a little more equal.
Yeah, the vast majority of them are the mosquito bikers, so that's not going to be a problem.
Positions.
Yeah, because
Yeah,
they're temporary.
So,
they're
yeah,
temporary.
and when they come back in, next year, we can do that. And then we can certainly adjust within the maintenance category as well.
Mm-hmm. Sure. Okay, any more discussion, Danielle? All right, I think we're ready for a vote.
Andy Cornstrom, Darlene Kleppel,
Yes.
Danielle Chenoweth.
Yes.
Okay, thank you. Thanks for coming. You guys can stay with the rest of the meeting if you'd like, or you're welcome to go do something else this evening.
Well, thank you so much for having us, and thank you all for raising the minimum wage. Thank you all.
All right.
Thank you,
Thanks.
guys. Y'all.